This morning, in my opening remarks, I spoke about the work that we need to do as First Nations citizens, health directors, First Nations governments, and organizations. We need to decide what is the authority of our authority. And I was speaking to this slide without realizing I was. We're going to create a new BC First Nations Health Authority. It will respect, support, and augment the current delivery of health programs by BC First Nations and their health organizations. So at first, we're taking over what exists. But as we organize ourselves, as we gain confidence and begin to believe in ourselves, we'll take those steps to design our own programs and services, to design our own investment plans on the things that we believe that we need to do to make a difference. Our authority will measure progress and identify areas of needed attention through an agreed-upon tripartite process of reciprocal accountability and transparency. Now, I mentioned earlier that we can design a very effective sickness system, and it'll make sure that when our people aren't well, that they're in need of care, that they're provided for. But that in itself is not going to create wellness. That we need to make sure that we create institutions, mechanisms, vehicles, the ability for us to influence the determinants of health. That's what the next slide is talking about. Provide BC First Nations greater control over federal and provincial funding envelopes for First Nations. In my view, that's not just about those things that are currently provided by Health Canada or Indian or Northern Affairs, but instead looking at all of the important issues to our community, making sure that we influence the government as it takes decisions about its budgets. We need to make sure that we're organized and that we're advocating. So when John Luss, an MLA from Chilliwack, who's been asked by the Premier to travel around the province of British Columbia to engage in a dialogue with British Columbians about the budget, this next budget, and the challenges associated with a recession budget, that we're organized in providing direction and advice to the government about how it deals with our investments. Create clear mechanisms for government, First Nations, and health authorities to work together to align services for the benefit of BC First Nations. We have created a number of councils. Those councils are all working in the caregiving field. They have slightly different emphasis, different priorities. What we need to do is organize the work of our own councils to coordinate the efforts of those of our chiefs and leaders and directors of delegated agencies and children and family that are working effectively with those of our leaders and our teachers in the school system, that are working effectively with those of our leaders and organizations that are delivering Head Start and other related children development programs, with health, and with any other organization that's in the caregiving field. We're going to have to make sure that we do that work together, that we define those relationships and we create those opportunities to make sure that we are working effectively together.